I'm glad the Minister of Health is here. Again, I want to appreciate the government chief whip. The issues we raise, she follows up. She writes, I get a copy that this matter was raised. So she writes to the relevant minister asking them to follow up. That's a good thing that should keep happening. So that then we are able to keep track. So one of those issues was about medical interns, Mr. Speaker, that I've raised severally here. Today I received a letter written by the President of Uganda Medical Association. He has written to the Minister of Health, medical doctors, healthcare professionals, key stakeholders, and the general public. So I received this letter in two capacities. As a key stakeholder, because Parliament is a key stakeholder, and as a member of the general public, because indeed I am a member of the general public. Uganda Medical Association is giving a position on the welfare of medical interns. Asked this question again and again. It has yet to give us a satisfactory response. So the medical professionals are, one, encouraging the interns not to show up where they have been posted. It's in this letter. And number two, they are saying if in 14 days government has not addressed the issue of facilitation of medical interns, the doctors, all the doctors, are going to carry out industrial action and lay down their tools. And they're saying throughout the industrial action, only emergency care and essential life-saving services shall remain available. I firstly want to table this letter. I don't know if the Minister of Health has gotten his copy, but me, I've gotten mine as a member of the general public, so I'm laying. The concern, Mr. Speaker, is when this issue is not being addressed by government consistently, we get a problem, because medical interns were posted. Many have not reported to their postings. Why they're saying they don't even have transport to get them there. They need resources to rent where they'll be staying, for feeding, for transportation, because many will not be staying very close to their health facilities. And these people are saying they are not students. They are medical doctors who are now on practice for the 1 year that is mandatory. That's their argument. As I mentioned the other day, the Minister of Health was not around. He has been moving around different health facilities, sometimes in the middle of the night, 2 a.m., 3 a.m., to monitor. And who does he find at these health facilities? It is medical interns who are doing the bulk of the work. And so they're saying, government, why do you not want to value the work that they are doing? But number two, how do we expect them to go and do the heavy lifting? Sometimes they are on their postings for 48 hours non-stop. We need a response to this matter. Now I'm worried when there is a threat of industrial action by all medical workers. And I know, Mr. Speaker, it's easy to say, you medical doctors, be patriotic and report to work. But they're saying, government, be patriotic and pay them for this service. We need a response to this matter, Mr. Speaker.
Thank you. This issue, yesterday I received several members raising it on both sides, even today. So when the minister was entering, that's the issue I told him. At the end of matters of national importance, I'll give him a chance, he updates us. But since you've raised it now, Rob, I think the minister can respond right away.
Thank you very much, Right Honourable Speaker, and the Honourable Leader of Opposition, and Honourable Members, for raising this concern. Yes, this matter was raised, and the last time I gave a response was, I am undertaking consultations. I have a draft statement for Parliament, but I have not concluded all the consultations I need to do. But just in terms of update where we are, this matter is arising from a new policy that has been passed regarding health training, and which affects interns, deployment, welfare, and other aspects. I did meet the interns, the pre-interns, because they are not yet interns. You become an intern when you qualify and report and sign a contract with the management of the hospital where you are doing internship. That's when you become an intern and you have a relationship with the government. At the moment, those who are writing are graduates who have completed their university training. They have passed and their names have been forwarded to the Ministry of Health for deployment. We have indeed deployed them to all the hospitals where internship is done. And the deployment letter was saying you report between the 3rd and the 14th of this month. I did meet the leaders of the pre-interns, about 60 of them, and we had a lengthy and cordial discussion of about 6 hours. It is rare for a minister to accord 6 hours to a group because we have a lot of work that we do. But I patiently had a discussion with them for 6 hours, and we did agreed that one, yes, we share the concerns regarding the new policy measures regarding their welfare, and I undertook to do consultations, but urged them to report for deployment as the consultations get concluded. I think the challenge that these young people are getting are external forces that advise them, you lay down your tools, you don't report. I must state that the interns need that internship if they are going to practice the professions in which they have trained. Interns, I don't want to sound like insensitive, are not employees of government per se, but internship is a period when you are transiting from being a student to becoming a fully licensed professional. That should be clear. It is also not true that is interns who run healthcare in this country. Yes, they make a contribution, they provide labor as they learn, but the healthcare is provided by different cadres in the health sector. For instance, we have health center 3s, health center 4s, and a number of district hospitals where we don't post interns. Are we saying they are closed? Are not running. For instance, the team which has been doing internship has now concluded their tour of duty, and now the new ones are reporting. We have not closed any hospital because there are no interns. So it is not true to say that it is the interns who run healthcare in this country, but we do definitely appreciate the work that they do as they train to get fully licensed. So I am sure the interns are watching me. They should get that fact that they need this internship. We have the commitment to address the concerns which they are raising, and that's why I'm asking for additional time to conclude my consultations so that I can come with the final position we are taking.
Do you anticipate when you might conclude the consultation?
Maybe by next week I should be ready. By next week I should be ready.
Procedure?
That's the position. So the deployment.
Procedure.
Honorable Kwizera, you've been here long enough to know you cannot access a microphone.
So right, Honorable Speaker.
The presiding officer.
Right, Honorable Speaker, I did guide the pre-interns that no matter where there is goodwill to listen to them, we have not condemned them, and we
auditing matters we are handling, we are about to handle, we are going to handle regional referral hospitals. Right, Honorable Speaker, one of the major auditing queries that comes out are the staffing levels in these regional referral hospitals. To dismaying structural levels, that a hospital that has a structure of 100, they have about 23%. They have 24%. They have 27%. Actually, the one I saw which was doing best had 27%. Right, Honorable Speaker, when the people of Uganda say that it is the interns that run these hospitals, they are in a reference to the inability of government to have enough wage bill for these regional referral hospitals to recruit and have staffing for doctors and health workers in these institutions of ours. So the procedural matter I want to raise is with the minister, who is up to now claiming that it is not these interns that run these facilities. Right, Honorable Speaker, yesterday I went to Nagu.
Procedure matter, Honorable.
The procedural matter, Right, Honorable Speaker, is whether the minister is here proceeding well to emphasize the fact that these interns need the training other than the service our people receive from these interns. Thank you.
Minister, are you proceeding well?
Right Honorable Speaker, I will soon be, I think the Right Honorable Prime Minister last week, when commenting on the proceeding business, she undertook that we shall bring a comprehensive paper on the delivery of medical services in this country. And I hope we shall have enough time to discuss all those issues.
That is this week. She promised this week. So I've been waiting for it.
I have been waiting for the order paper to come out.
No, but I don't have a statement. I only put on order paper, statement submitted to the clerk. Yeah, the statements, Honourable Minister, you submit to the clerk, then the clerk presents to me, we look through as a team and we say, let us put this. I don't want to put you and then you come to apologize.
Me, I'm ready. I can address you on that subject.
So can I put you tomorrow, Honourable Minister?
Yes. No
So kindly share the statement today. Share the statement even in the morning, then we put you on the order.
Okay.
Order paper.
No problem. There are two statements. There's one for interns, then one for the comprehensive services.
Comprehensive
So the one for the interns, I'm concluding the consultations.
Okay.
The one for the comprehensive delivery of medical services, I think our offices will arrange, and tomorrow I will be set. Okay. But let me, as I conclude.
Honorable Kwizera,
Yes.
is the initial. You can also touch it.
I did say that the debate on interns arises from a new policy on the health training, which encompasses issues of pre-service training, that is at university and tertiary education level, but also in-service training like the internship. So there is a policy that has been passed, which when I bring the statement, we could get copies or extracts of.
No,
Extracts from
Honorable,
the
just lay
policy.
on table.
Yes,
Okay.
so I will
you
bring
your lay on table, then we shall distribute it electronically to members.
Okay, no problem. Then the issue, I want to state, no, we should speak with evidence. There is a time some years back when interns delayed to report for about 6-7 months. And when the Ministry of Health did analysis, found that mortality rates went down in institutions, in hospitals. Yes, just hold on, yes. Yes, you see, we don't speak for the sake. Mortality rates, but the senior health workers, doctors, were available, although they overworked. But they overworked, but the mortality rates reduced. The meaning of that.
Point of order, Honorable Zaake.
Mr. Speaker,
Yes.
is the minister in order to say that when the interns delayed to report to work within 6 months, that the mortality rate went down? You have said right here that we speak with evidence. Can you please table the evidence?
Now, you see, you asked, you made a ruling, you did.
Mr. Speaker, is he in order to say that the mortality rate reduced to that level? Give the evidence, give the evidence.
Thank you.
Are you in order?
Honorable Minister, when they put you on order, you wait for a ruling. Yes. Yeah, now, colleagues, that becomes difficult for the Speaker to rule on. Because if the Minister has his facts, okay, based from statistics, so maybe we can ask him to expound on that, to give us more But I hope our interns are not a danger. Okay, are not a danger to our patients and community.
What I am raising on the floor is factual, because I cannot be reckless on the floor of Parliament. But the implication and the meaning of that was that our senior doctors usually are absent and cheat government. They don't even do adequate supervision of interns. So you find interns are doing the work and supervised most of the time. And there are discussions we are having in the ministry to bring reforms. Like we are going to discuss the issue of dual employment. I have said this in public, that you find a consultant doctor is employed in Murago Hospital, but probably he offers only 10% of his time to Murago. The rest of the time he's in his private clinic. There are doctors who are consultants in a government hospital, but you find he's heading a department in a private university, and that's where he spends time. So that the fact I have given you speaks to that the interns, you find most times do internship without proper supervision from the seniors. That's why I said the seniors were ordered to be on the wards, and they were there in the hospitals, and mortality reduced. I can bring you documented evidence on that when I come.
Thank you. Honourable Minister, conclude.
In conclusion, my message to the pre-interns is that we expect them to report. And on the 15th of this month, I will ask the directors of the hospitals to give me an update in terms of who has reported. No. Allow me to run the ministry. And those who will not have reported will be considered to have forfeited their placement for internship as we handle their issues. So please, the pre-interns who are watching, report. No.
But Honourable Baryomunsi, I don't know why you're listening to neighbors. You're the only one on record.
So let the interns report as their issues get handled, because we respect them, we respect what they are raising, and we feel concerned about them. We are not resisting what they are saying, so there should be, and they should not be misled by anybody to start confrontation with the government. It will not pay for them. I thank you very much.
Thank you. Honourable Minister, on our side, we hope you can conclude the consultations. We hope you can conclude the consultations. And from my experience of the little time I spent in cabinet, I usually don't want to push ministers to make commitments in a certain way, because sometimes, especially if they have a financial implication, they need concurrency with cabinet. So I do hope that Monday, Honourable Minister, I do hope that Monday you can raise this matter in cabinet, you consult further, you conclude on it, and then on Tuesday you update the House. Yes, I hope that will be more helpful. So, honourable colleagues, today is International Youth Day. Yes, so congratulations to the youth of Uganda. Now, you see, government chief whip, government stopped celebrating these holidays, okay? But we request that we remain with the practice of bringing statements here, okay?